Hello everyone and welcome to today's Fireside Chat. We are going to be getting started and I just wanted to give you a quick overview of the expectations for today's call. For those of you who've joined online, you may see a set of slides in front of you. We'll be scanning through those during our conversation. For those of you who have just joined on the phone, that's perfectly fine. We will be having a conversation that should be purely audio, and that should be fine. You should be able to hear everything there. If you are on your desktop, there will be a Q&A portion at the end. In the lower left corner, there's a box for participant feedback. Please feel free to use that throughout the conversation should you have questions or comments, and we can build that into the discussion as we go along. So thank you all for taking the time and joining us today to learn a little bit about one of our leaders, thinkers, and doers here at SOPHE. Without further ado, I think I'm going to go ahead and hand it over to today's presenter. We have Escoffery, who is the current president-elect. As of next March, she will shift into the president role for the Board of Trustees of the Society for Public Health Education. So, why don't you take a couple of minutes and tell us who you are and what brings you to SOPHE?
Thank you, Heather, and it's a pleasure to talk to you all this afternoon. I am an associate professor here at the Rollins School of Public Health at Emory University. I've actually been here for about 25 years, so really loving the work that I do in health promotion every day. Some of my kind of day job responsibilities are teaching health promotion courses to both doctoral and master's students. Just some of the courses I teach that some of you may have taken in your health education or community health journey are things like community assessment, program planning or intervention development, grant writing, and use of theories. And in terms of my research interests, they are broad but all cover areas related to cancer prevention and control. And there I try to focus on studies that will increase use of screening, whether it's mammography for breast cancer, FIT or FOBT, or colonoscopies for colon cancer, and of course PAP and other types of things for cervical cancer. Other areas I work on are chronic disease self-management, which is basically studies that focus on helping families or patients and caregivers, helping them to manage their disease outside of the clinical setting. So what do they do at home every day? So that could be what do they do in addition to taking their medication, things around wellness, how do they get social support for their disease or when they have flare-ups and things like that. And the final area that I love to work on is evaluation and implementation science. And implementation science is trying to get what we know what works out into communities, so organizations, clinics, health education agencies, and health departments can use package programs or use evidence-based policies to improve the health of communities. So that's just a little bit about what I do in my day job.
Excellent. That's quite a bit. So it seems like you really have a broad range of not only experience but interest areas. So that's fantastic. Thank you for sharing. Can you tell us a little bit about what really brought you to SOPHE or the Society for Public Health Education? How did you get engaged and sort of what experiences have you had while being a part of the organization?
Yes, so I feel like many of us, we are kind of pushed or nudged by mentors. So I am one of those that like to learn a lot from others, and my mentor, Kathy Miner, who some of you may know, and others here at Rollins were saying one way to kind of keep up with what's going on in the field and learning from others is to be engaged in professional associations. So I started joining professional associations both at the local level, which was Georgia SOPHE or Jiffy at the time, and also joined National SOPHE when I was in my graduate program, just my MPH here at Emory. And I have found that SOPHE is a great space for what I call is knowledge brokering, is getting information and resources for what we need to do on a day-to-day level out to us as practitioners and researchers, where we can use those resources to better do what we do on a day-to-day basis. And as I have engaged both at the national and local level, I have also enjoyed just meeting people and just seeing the variety of settings and job titles that people have in health education, but all with the end goal of trying to promote health and well-being, and also promote environments that support health.
That's excellent. I think it's really interesting because you're not the first person who's been part on the executive board or the board of trustees that's mentioned really starting at the grassroots level and being engaged at the chapter level. So I think that that really speaks volumes as we grow into different forms of leadership, that that's such a relevant component of that is really getting involved at a closer level, and then defining what that looks like in leaderships and skill building as you want to grow into or develop into different roles. Can you, this is something we hadn't really chatted about, but can you maybe mention how often would you say that you utilize, I don't know how to say this quite specifically, but like your membership. So for example, you mentioned having these other colleagues or these other professionals that you can share resources with, or maybe meet up with at a professional development conference, something like that. How often would you say that you do that as it relates to your SOPHE membership?
It does vary, but I would definitely say at least monthly, and sometimes by several times a month, because I am either as a faculty kind of engaging or kind of perusing the literature on journal articles to kind of bring into the classroom, or journal articles that relate to my area of work or research. Sometimes it's just areas of interest. So of course,
Gotcha.
SOPHE has 3 wonderful journals that we could pull through, and sometimes it's the most current things coming out, but sometimes they're kind of seminal work that I can refer back to, and I'm like, what did Karen Glanz write about theory here, or
Right.
what did some of the evaluation folks write about evaluation history, and then of course the newsletters and things like that often bring current topical areas, whether it's opioids or smoking cessation, and resources in that area. So just being able to tap into the different ways that SOPHE gives members, just information and tools.
No, that's important, and I appreciate that, because as the manager of membership and marketing, it's always good for me to know kind of where people are finding the value and what it is that they're able to utilize as part of our membership benefits. So that's important, and I appreciate you mentioning that. So something else that I kind of wanted to ask about, as you mentioned, being sort of getting your foot in the door, really starting at the local level. In what ways can someone get engaged or start to participate with SOPHE or their local chapter? How would you suggest maybe someone else getting started, or if you were to mentor someone, what have you said to a mentee in order to support them getting their foot in the door?
Yeah, so one of the first things I say is join, because you can't quite learn about the association or see it in action without joining. So that's very important. I feel like students and young professionals forget that once they leave the hallowed halls of their universities or colleges or smaller, 2-year programs, is that you are not learning the latest and greatest anymore, and we become dated. So joining just makes sure that you stay current and that you continue on with your professional development. And so once you join, I often say it's okay to spend time, if you need to, just getting the lay of the land, watching others, learning about the association, learning about its governance, in air quotes. What are the committees? What's the executive board looks like, and then learning about ways to volunteer. So if you want to jump into volunteer, I kind of tell folks to kind of think about those episodic things that don't have a lot of commitment. So students, look out for things like can you review abstracts, or can you volunteer on, with registration, and perhaps even get some dues or fees, taken off because you're helping out. Can you
That's an
attend
excellent
one
suggestion.
one event? Yes. And then, if you want to jump into a longer term commitment, maybe see what committees align with your interests. So if they have an advocacy committee, I'm thinking about our local chapter. We have advocacy, we have communications, we have membership. So if there's a committee that resonates with, maybe you want to be in digital health or social media, join communications and help our chapter tweet out events and things like that. So, just thinking where your passions lie and trying to align that with ways to volunteer, and it also helps you build your resume.
Awesome. Yeah, those are all, I think, excellent skills, and I think you're right. I think even picking those short-term projects are a great way to start to build your volunteer experience one element at a time, and I think that that's a great way to start out so that you can build off of that. So as president-elect, there's a lot that you're going to be responsible for and things that you're learning right now as part of the executive board. I'm just curious, what were some of the skills you felt were crucial to your success before deciding to take on more responsibility in this new role that you've been elected to?
Yes, I have a combination of skills / guidelines or guidance, if you want to call it that. So I think my first one is just be active and engaged, because then you kind of know what's going on. I think part of any leadership position is kind of getting the lay of the land and listening, and also seeing what is going on around you so that we could all get together on the same bus and kind of meet some of our destination goals. So throughout my professional development career, I have tried to be within the organization, taking on small and large roles just to kind of get to know the organization, the major players, the history, and then it just allows you that flexibility of participating more or being engaged more. A second one that I would mention is just being able to be passionate and advocate for our profession. I call myself a health educator, even though I sit in the behavioral sciences department. And I think that professional identity is key to doing what I have done to advance our profession. I've been involved with the National Commission for Health Education credentialing for decades, helping them help our students take the CHES or MCHES exam. I've helped with the study guide as a co-editor and helping them study actually through that study companion guide. And so within SOPHE, it's kind of doing the same role, trying to get professional development activities or webinars together for members. And so I was very engaged in development of the SOPHE Center for Online Resource and Education, or Georgia SOPHE Core, just to house materials and professional education so that we could stay contemporary in the field. And I think the last thing is to just try to pass it on. And so just trying to get one of the topics that you mentioned today, getting people engaged and telling them a little bit more about the profession. So I think the importance of mentoring and begetting new mentors in our profession is key to kind of keep our membership vibrant, right. And also help people just see the value of our profession and or SOPHE as a professional association.
Yeah, I think all of those are relevant. I do think that it's important. We have a strong focus on CHES and MCHES, which is the Certified Health Education Specialist, unique specialty there, and the Master CHES as well. So I think that you're right. Having that passion, having that engagement, and working alongside other collaborative organizations is a great way to kind of develop some of those skills as you look to promote or become more heavily involved in SOPHE as an association. So that's awesome. I just also wanted to know, what are some of your preferred public health education topics? Do you have a preference? I know you mentioned some of your um, areas of focus in your particular day-to-day role, but I mean, just generally speaking, what are some of your preferred areas within health education, and why are you drawn to them?
Yeah, so I kind of brainstormed two areas. So the first one is community assessment and engagement. So in teaching that class, I feel that we often can present the skills and concepts in many ways, but one of the things that I think is critical is not just getting data about communities from the census, community, county or community health ranking type data, hospital data, et cetera, but also that added bonus of community engagement by going out and seeing the community itself, so whether it's windshield tours, key informant interviews, and also engaging with your community or populations through any data collection form. So I think community assessment shouldn't just be about secondary data, as I just mentioned, but just getting into the community and understanding what their values, what their needs, concerns, and assets are. I think that is very important to help us use that data, whether we're developing a future program or policy implementation. For us in research, we use that as quote-unquote formative research to develop intervention strategies. And so I think that's critical. The other area of where I say engagement is a lot of times when I have worked in kind of clinical type research or my health services research, that community engagement around caregivers and families, I think, are also important in how we help families and patients take care of themselves outside of the clinical setting. It's so often we talk about patient and provider decision making, but we forget that they're nested in a family or support structure, and that is actually one area of research that I feel like we haven't investigated a lot. We do a lot at the individual level, and we're starting to do more at the multi-level or policy, but we haven't really studied a lot about social support, family support, and how that helps health. So that's one of the areas of interest. The other area I mentioned, implementation science, and I would say the kind of more public health vernacular is evidence-based public health. So how do we use what we know works, whether it's from systematic reviews where they have culled the literature and finding evidence-based strategies or package programs like the CATCH program or the Body and Soul program, and take it to other communities so that we improve their health that way. That's one area that I think is very important, because a lot of people, as you think about local health education, are thinking about, well, what can I do to address this cancer or diabetes? And I would like them to say, oh, what has been done, and what has been proven effective? What can I use? And perhaps not start from scratch developing their own program, because if they look at some of the evidence-based resources, they might already have a tool or a program or a combination of strategies that they can use.
That makes sense. No, I think that's right, and I really like that interest area as well. I think that would be something that I would overlap to in regards to that continuum of care. It's hard when you look at someone clinically or maybe one-off, and you're wanting to identify whether it's their chronic condition or their issue from a public health standpoint, but then you don't factor in that there's a whole, like you said, a whole community, a whole support system, that continuum of care. What does that look like, and who's all involved in that decision-making process? I think that's extremely important. So I know we don't have too much time on these chats, but one thing that I like to do as part of engaging with the leaders of SOPHE is really get to know you on more of a personal level. So I'm just curious if you, I'm the type of person that enjoys positive affirmations and phrases or mantras, different things like that. Do you happen to have any quote or phrase, anything that you live by that kind of helps to encourage you or uplift you? Is there anything that you resonate with?
Yeah, so I think I did give you a quote. To me, there I think is two areas that I see that's very important to embrace in life, and one is the journey, and the other is just taking small steps, and that's why I really love this quote. And so I'll let you all read it, but for those that are on the phone, it's the key to realizing a dream is not to focus on success, but significance, and then even the small steps and little victories along your path, which will take you on to greater meaning. And it's by a strong woman, Oprah Winfrey, and I think it just tells me that when I go through life, it's a lot about the journey.
That's
and
perfect.
The people, and the people you meet along the way. And I feel SOPHE is a part of that journey.
Yeah, I would completely agree. I think that this is a unique. I was just telling some of my colleagues here earlier that I think this is a very unique organization. It has a sense of family to it. It definitely has a sense of sort of closeness that I think you don't find everywhere, and that's really unique to be able to find both in your professional space this overlap with how you can grow as a person and how you can make an impact and leave a legacy. And I think that those are both extremely crucial to one's development. So I would agree with that. I know before you have told me too that one of your favorite leaders is the Dalai Lama, and I'm just curious why that person?
Yeah, well, I have many. He came first to mind just because he is affiliated with Emory. We actually have a really strong religion program here, and he has come and not only interacted with students through our theological programs, but also faculty and staff. The other thing about his life is he was living in exile for a long time. But a lot of his teachings are about what I think helps us every day with the different aspects of health that we all have learned about, the mental health, the social health. So a lot of his work, and he has a book out on happiness, is about living with compassion, being present, getting along with others and your environment. The global community is local, so I think it touches on all of the dimensions of health that we learn about as a health educator.
Yeah, that's perfect. So with the last few minutes that we have together, I want to open it up for a couple of questions. Should anyone have any of those, you can feel free to use the chat box if you want to leave a question or comment. But while we still have a couple of minutes, what do you think, for those who tuned in today, what are 3 things you want them to take away as part of getting to know you, getting to know SOPHE? What are some of those takeaways?
Yeah, the first is about one of the things I talked about earlier, that leadership is really a continuum. A lot of how I think I and other people got started is just to be a follower. We were watching people. We were seeing people, seeing the people we admire as leaders, and then slowly we stepped up. And then look at where I am now. So you never know where you can get in terms of thinking about, what skills does it take to be a leader. The second thing I think related to what we need to do in terms of leadership and even in health promotion is getting out of our comfort zone, because sometimes that really gives us the edge to actually learn and try new things. I know I say that as a parent, but I feel like it's so true in your professional life as well. To be able to tell young people to build their resume, you actually have to step out and volunteer and sign up to do things, or do another practicum in an area that you want to do, to either build your resume or find what your interests are to kind of match what you want to do in your career. To be able to do what we do in health education, we might have to step out of our comfort zone to advocate or to educate so that people will do things that are right in our community, whether it's passing legislation or building new programs. And the final thing is, as I alluded to about the journey, is just enjoy the journey. You never know where it's going to take you and who you're going to meet. And so my professional journey has been with both Georgia SOPHE and National SOPHE. And I've definitely enjoyed that as I've gone through my career and as I'm about to take on the helm in March.
That's right. We're excited for it.
Thank you.
So we'll go ahead and leave a couple of minutes for questions. I did want to go ahead and share again a slide. We're coming to your town. We're coming to Atlanta for our next annual conference. So that will be March 17th through 20th in 2020. So folks online, if you haven't already, please do save the date and join us. It will be looking at health education and social justice and health equity, and really discussing a lot of the topics that I think have been very newsworthy over the past few months and will be very relevant to public health professionals moving forward and into the future months and years. And so I think that that's extremely timely. So we're looking forward to that, and I know that there's a ton of folks already in Atlanta working hard to make this a great event and provide lots of different professional development and educational opportunities along the way, both as part of the conference, pre- and post-conference, and things to do just around the city as well. So if anyone has a question, feel free to post in the participant feedback box. Otherwise, we really appreciate you making the time to come join us for a little lunch chat as part of our Fireside Chat program, and we will be posting these on YouTube, so do look out for them there where you can revisit them, see other conversations with other leaders, thinkers, and doers within the organization. And we're very excited to continue this process. So if you have any suggestions for membership, you can certainly email me, and also I'll put the slide back up for comms information, so you can follow her on Twitter or shoot her an email if you want to get connected. My name again is Heather. I'm the Manager of Membership and Marketing at SOPHE, and my email is hflattery, my last name, Flattery, at sophe.org. So if you have any questions or if you're interested in learning more about the organization, please do reach out to us. We look forward to hearing from you. And otherwise, have a wonderful Labor Day, and thank you all for joining us.